Constipation can be a distressing problem to anyone who experiences it. Why does constipation occur? How to prevent it? Let us see in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, every week a new video is released on a common health topic. If you want to see such videos, consider subscribing to this channel. Also press the bell icon adjacent to it to get instant notification on new videos. This week's video will be on constipation, a very common medical problem, especially when it is related to children. What is constipation? Constipation refers to a delay or difficulty in passage of stools. There is no universal definition accepted for constipation. When we say the term constipation, it refers to infrequent bowel movements, at least delayed by 2 or 3 days, or passage of hard and painful stools. Often there could be bleeding and there could be drops of blood on the outer surface of stool. Why does constipation occur? Especially in children. First of all, in infancy, that is under 1 year of age, any straining or crying before the passage of stools, especially if it is associated with normal stool, could be normal. That is, because of the lack of coordination, infants especially can have crying or straining before the passage of stools. This does not indicate pain, but once the child is little older, if it is associated with hard stools and pain, and often the child avoids going to toilet, this is called habit constipation or functional constipation. Why does this occur? Habit constipation or functional constipation is essentially due to two reasons. One is dietary, the other is behavioral. Dietary: intake of more refined foods and carbohydrates, including milk, cheese, potatoes, rice, all these cereal based diet can lead to constipation. And decrease in the fiber intake. Fibers which are normally present in vegetables, fruits and unpolished cereals, if these are lacking in diet, often associated with decreased fluid intake, can result in constipation. More often than not only dietary factors but also the behavioral issues contribute to habit constipation or functional constipation in children. What happens? A vigorous toilet training, a stress, even the birth of a sibling, or the child's resistance to toilet trained, all this can result in habit constipation. Often what happens is, child for some reason has not passed stool for a day. The rectum, there is no bladder like thing for feces, so the rectum where the stool gets stored is distended, which is not normal, but the rectum gets distended. Once the stool is in the rectum, stays unusually long, more water gets absorbed and the stool becomes even more harder. As the stool is harder, it is difficult to pass. Probably the child feels pain. Because of the pain, the next day child holds even more. As the stool gets harder and harder, it gets accumulated, the rectum gets stretched. When the rectum gets stretched beyond a point, the new formed stool, which is often softer, can get leaky. So the child may wet his or her diapers. Parents think the child is passing liquid stools. Often this leads to some parents bringing the child for diarrhea, whereas in truth the child is having constipation. As the child passes harder stools, this may damage the anus. You may get anal fissures, which results in bleeding. Anal fissure is a very painful condition. So this in turn again leads to holding of stools, which leads to constipation becoming worse. This creates a vicious cycle. Children who have this condition often are standing at a corner with their crossed legs, seemingly trying to pass stool. They are not trying to pass stool. In fact, they are trying to hold for the fear of pain. So these holding maneuvers indicate that your child may be suffering from functional or habit constipation. Is this the only reason for constipation? Constipation, whether in children or adults, can even result from other medical conditions. What are the warning signs that the constipation could be because of a medical cause other than a simple habit constipation? First, if a newborn baby has not passed stool for more than 48 hours, or if there is blood in stools, or if there is loss of weight, or in case of children, if the children fail to grow, that can be a result of a medical cause causing constipation rather than a simple dietary one. Constipation, especially if it is acute, associated with fever and vomiting, could be due to a surgical cause, so this again should not be taken lightly. Constipation, if it is also associated with urinary incontinence, is also a warning sign. So, if these warning signs are present, we have to visit the doctor immediately to ascertain the cause of constipation and to get the proper treatment. What the doctor does is get a good history and examine the patient and ascertain the reason for the constipation. Usually, constipation, if it is due to a functional or habit constipation, doesn't require test. But to rule out other significant medical causes, you might require some test. What is the solution for functional or habit constipation? There are three parts to the management. The first is change in diet. Second is change in behavior. Third is use of stool softeners or laxatives. What should be changed in diet? You need to increase the fluid intake. You need to increase the amount of insoluble fibers in the diet. What are the sources of these fibers? We might have heard about prunes, that is dried plums or other dry fruits which are relatively richer in fibers. Fruits like lychees, apples, these also contain higher amount of fibers. Vegetables, especially cabbage, cauliflower, greens, all these contain higher amount of fibers. So these should be taken more, and refined foods such as bread, rice, milk, cheese, these should be reduced to a minimum. What are the changes in behavior which will help in constipation? In case of children, encourage the children to sit in a toilet seat after every meal to expel their feces. Especially if the children are constipated, immediately after a meal there could be an urge to pass stool. This should not be curbed and they should be allowed to pass stools. If vigorous toilet training is done, this toilet training can be delayed in case of young children so that they don't become constipated. For a better healthy habit, get the habit of sitting in a toilet seat immediately after a meal. This becomes regular and the constipation may be relieved. Finally, if dietary and behavior modification is not going to help in constipation, we might try stool softeners or laxatives. These are essentially medicines. So before taking any medicines to get the appropriate dose, you need to consult a doctor. Often these drugs might have to be taken for a little longer time to get better results. In acute constipation or stool impaction, that is, stool has obstructed the passage, we might require enemas, which should be done only in hospitals. Previously, people used to think usage of laxative can lead to addiction. Laxative abuse especially happens when it is not taken in the proper dosage and for the proper duration. Today, you have newer laxatives which will be less habit forming and which relieve the constipation well. So consult a doctor if you have constipation to get relief. Friends, today we have seen about constipation, especially habit constipation which happens in children. If you like this video, share it among your friends and relatives. To see such videos, subscribe to this channel. Till we meet again, bye.